All right, I will call to order the December 9th, 2020 Program and Budget Committee meeting, and I'll start off by reading our mission statement. Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. With that, we'll move on to item number 3, adoption of the agenda. I'll take a motion to approve.
So moved, Burke.
Support Schmidt.
Phillips.
Motion from Burke, support from Schmidt. Any questions or comments from board members? All right, seeing and hearing none, all in favor signify by saying aye.
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 All opposed? The agenda is adopted. Next is item 4, hearing of the public. Anybody from the public wishing to speak on anything on this agenda? You have 5 minutes. Give us your name and address and make sure you unmute yourself. Anybody from the public wishing to speak going once?
Yes.
There's also another hearing of the public at the end of the meeting. Hearing of the public going twice.
There's somebody there then I think wanted to speak, Phil.
I'll wait until the end. It's fine.
Oh,
Is
okay.
that Alicia?
Yeah.
Okay, Alicia, we'll get you at the end. Thank you. Hearing of the public, third and final time. All right, we will close the first hearing of the public and we will move on to item 5. Request to approve item A, approval of Brainier LMS Learning Management System contract. Take a motion to approve that item.
Move to approve, Bush.
Support, Burke.
Schmidt.
Motion from Linda, support from Megan. Dave, did you want to speak to this item?
Actually, we have Lauren, who's our training coordinator on, and he's been our point person. Again, just as reference, the learning management system allows us to offer training remotely, which of course is very important during the pandemic. It is also, when we met with the Provider Alliance, it was their number one concern at that time. There's numerous concerns right now, but this is a benefit to our entire system, internal and external. And again, Lauren has been point. We've explored numerous options, and Lauren, I'll kick it to you for more detail.
Okay. So the entity that came out with the best proposal was Brainier LMS. The details of the contract were $109,970 for a 39-month contract, which 3 months of that would be utilized to set up the system, transfer information from our Relia system over so user accounts and historical data could be stored. Currently, we are averaging $160,000 per year for Relias, and we are limited to 3,500 seats. By moving to Brainier, we will obtain 5,000 seats, 500 internal price seats, as well as 4,500 external seats for $109,970. My rough estimate, and keep in mind I'm not a finance major, is that would accrue to approximately $370,000 in savings over a 3-year period. The cost per seat right now for Relias is $45.72 per user. We would be dropping that cost to $7.20 per year for each user. There's significant savings, and I think this is an entity that is willing to work with us and grow with us. 80% of their updates to their platform come from customer suggestions. So they are very receptive to that. I think that this would be an excellent opportunity to kind of move forward and provide us with the opportunity that we have seen that would provide our staff with a nice work and balance to their life. We have a number of staff that sometimes just make a drive from 1 hour away for a training, and the ability to provide that virtually would be tremendous to their balance of life and their health. We all know a healthy individual is more likely to provide better services, to be in a more dependable and focused situation to support the individuals we do.
Thanks, Lauren. Thanks, Dave. Any questions or comments from board members?
I have a
Mine-
question. Go ahead, Megan.
Sorry.
We'll do
Lauren-
Megan and then Linda.
Lauren, I remember, I think I asked you when you first brought it up earlier this year, this allows you to utilize their content on the LMS, but also for you guys to upload your own trainings, right? Like if Dave does a training or if you were to do a training for a department, you could upload it and then blast it out to employees as well, right?
So they do not have a content, a library.
Oh, so it's
that's the
all
big
upload.
cost for Rely. So we would be building our own content, utilizing our training department to build up, refine existing trainings to make them more interactive and versatile to be able to be utilized on anywhere from a cell phone to your traditional desktop computer. We would have that ability, and that would be a process, but it would provide us with that. We also have resources within the community like Improving My Practices that would still allow staff to accrue continuing education units that are needed for their licensure.
Okay, perfect. And then they'll allow you guys to put quizzes at the end if it's a more serious type of training, and you guys can keep track of all that stuff with it.
Yes, the data that we'll be able to pull is going to be very detailed. Depending on the formatting, we could even draw down to as much as how much time an individual is spending on a specific training, to the most frequently inaccurate answered quiz questions that will give us guidance on to, is it the training content that needs to be revisited and revised and expanded on, or is it the way the question is wording that is creating a lot of confusion? So we'll be able to get a lot of very specific data that Reliance is just not set up and powerful enough to provide us.
Okay, that's great. Thank you.
Of course. Thank you.
Thanks, Megan. Linda and then Lori.
Hi, I have two questions. The Reliance that I was aware of is an opportunity where employees can earn CEUs. They have different topics. They're a catalog of topics that employees can get CEUs. It doesn't sound, well, you can answer that. Is this available through this contractor?
We would still be able to apply for CEs for our trainings internally. But as far as a catalog library, it is not available. We could look into that with the substantial cost savings. We could explore possibly seeing if there are libraries out there available to also start to bring training content over.
Okay, and then I had a question about, so the ability for soft skills or customer service or all of the, I heard you say, so it must be true, that they don't come with anything. You have to design it all. There's a cost to doing that, of course, right?
That is correct, yes. And we have resources in place currently that could work on developing those in between current trainings. The ability to have a virtual platform and permit staff to participate there also is a benefit to our training team, as we could provide the training to more individuals, therefore focus and shift attention into training content development.
And the board, we took our training through Reliance recently and had to get certified. Did you develop that training, or was that a training they had on the shelf? You don't know, maybe.
The corporate compliance training, that was developed in-house by
yes.
Billy Cope, and then I believe that
Okay.
Ms. Holman has refined it, yes.
Okay, thank you.
You're very welcome, thank you.
Thanks, Linda. Lori, go ahead.
Yeah, and will these trainings also be available to all the agencies that we use for whether it's our CLS workers or that need the continuous trainings? They will also be using this system, so it won't only be employees of CMH, but also all the agencies to keep up. Is that correct?
Yes, I have, from the entities that I have heard back from, we're right around the 5,000 user mark. And if we clips that, it would be a 67-cent fee per month per user if we did. So what that would allow Ms. Phillips is for individuals to not have to go to external training resources to complete trainings, but to be able to complete them within our system. And we could utilize that data to drive more focused areas of training.
Okay, good.
Lauren, question for you.
Yes, sir.
There's two, I believe, agreements with this item.
Mm-hmm.
Are you looking for kind of a blanket approval for both, or is this a one or the other type deal?
So that's a very good question. We are just looking for approval of whatever the board would think would be most appropriate at this time. There is a 39-month contract and a 27-month contract, and that is the price differentiation between the contracts. Outside of that, the language within the contracts are consistent.
Okay, thank you, Lauren. I think I was cutting Nick off. Did you have a question, Nick?
Yes, yeah, two questions. Well, you just raised an additional one. Which of the two are you recommending? I assume the longer one is more economic. And two, this is a huge savings, which none of us object to, but what are we not getting? I mean, how does this particular entity compare with Reliance among our peer groups around the state?
So my recommendation would be to go with the 39-month contract. The rationale behind that is that there will be quite a bit of work involved to get it up and running and to build into our own library. There would be quite a bit of resources utilized. So to continue that relationship and maximize the opportunity with the current cost savings we would be getting, that would be my recommendation as far as the 39-month. The cost savings could be utilized in other areas such as the training content library and looking for external resources that we could do.
But how did Reliance have its own library? Is that why there's a savings here? And again, how does this entity compare, or what is its representation among our peer groups around the state?
So Reliance does have its own training content library. They're one of the only vendors with a content library and an LMS.
That's the bulk of the savings.
That is a significant bulk of the savings. I've participated on state training committees, work group, and there have been other entities that have vocalized concerns about the increasing cost of Reliance. They build into their contract the ability to increase the cost annually, anywhere from 4 to 5%, I believe is what that would be. And so a lot of entities just like us are recognizing the cost that we're kind of losing. And I'd love to see us start to partner more with Oakland County, Wayne County, and other PIHPs and CMHSPs to kind of start to develop content and bring it into our own, just like Improving My Practices is kind of doing.
You're missing my question, though, I think.
I'm sorry.
Which is, our other CMHs, PIHPs around the states using this company, and if so, what's their reputation with them?
To my knowledge, there is no other users right now within the state for this entity.
So is this a new company?
This company's been in existence for a while. I think that Reliance kind of captured a majority of the state based on the fact that they had a training content library. And once one entity.
Of any other entity, do we know of any other entity anywhere that's already using this company, or would we be trailblazing?
I am not aware of anywhere else. We would be basically trailblazing.
Okay.
Thanks, Nick. Ryan's up next. Ryan, are you there?
Here. I'm muted. There we go. To follow up with the last statement, if we're trailblazing, and that means we're developing all the content, it seems like there would be an increased cost there. Is there any way before we enter into this deal that we could have wait and see if there's other CMHs that jump on board? That way there's that maybe Nick's point, shared services or economies of scale, something like that. I mean, with Relias, we have all this other information, ways to get training. I mean, what's the benefit to this versus say Relias or what the other CMHs are doing?
So the benefit would be the cost savings, and that we are losing out on the training content. I would have to run some data to see how often our system is actually using the content library. So the availability of it is great, but if we're not utilizing it, then it becomes a wasted cost at that point. And I think there are some other resources out there improving my practices. I am not sure where every other PIHP sits with their current contracts. I know Detroit Wayne has their own system built through an entity that's public facing, and they build their own content into it as well. And that's where a lot of improving my practices contract.
If I kind of follow up on Ryan's question, I guess, you know, I like the savings, and I certainly like the idea of using our own content. Do we have sufficient content to cover the trainings that folks need, or are we using Reliance's services in that library? I think that's the point you were making. If we're not using them, then paying for them doesn't make any sense to me either. But if that's what we're relying on and have to rebuild the library completely, if we've got the training content either in-house or from other services or from other entities already, that's one thing. If we're going to have to build it from scratch, then I've got some concerns. If you don't know the answer to that question and need to have more information, I don't mind moving this to full board and you can get us that information by then.
So a majority of the content that we require is ours that we developed. There are content areas such as confidentiality of substance use, where improving my practices would provide a nice pivot point at this time while we work on developing that training. So there are some options within it, but the majority of the training, limited English proficiency, cultural competency, those trainings are done internally.
We're not going to be in a position where if somebody needs to be trained in a specific area within our network, they can't get it because we haven't developed it.
To my knowledge, I wouldn't be aware of that.
Okay, I think that's the significant point. We obviously have to have these trainings available, and I don't mind doing them in-house, but if we have to do them in-house, that may take some time. So, okay, thank you.
Borrow on Nick's point. I don't know if anyone else has a question. You've already, we already have these trainings developed. Are we able to transition the currently developed trainings and simply just plug them into this new system? But things that we've already developed, or is that a problem?
We would be able to take our trainings over in the current PowerPoint format and just simply upload them to the LMS. An e-learning authoring tool would allow us to make them more interactive, to be HTML formatted, to change with the delivery device's size and format it appropriately so it's more user-friendly, if that clarifies.
Yeah, that makes sense. How many programs roughly would we transition over? Not training programs would we transition over about?
So there are some things that we would still want to do in a live training format. I would say probably a good 90% of our stuff would be able to carry over.
Okay.
I have a question, Phil, when it's second time around.
Anybody? Yeah, anybody else on the first round? All right, Linda, go ahead.
I'm familiar with Relias because they are a vendor always at our conferences and always answering questions, and most people in the state use Relias. So I have a question about how you found, Lauren, have I ever met you before? Hi, Lauren. Are you?
You know, Ms. Bush, we might have crossed and passed during a board meeting at the MCCMH West building.
Okay, great. Nice to see you. Thanks. I'm concerned how this company came to be in your awareness. And the other thing is my understanding of Relias is that a lot of employees are able to get their CEUs through there, that they need to keep their credentials, that we need to show for CARF and so forth, that they have, you know, their continuing ed classes. So I'd be concerned that if we break the contract, number one, we have to ensure that people still get their certificates and that the records are intact. But back to my question about how this company came to your awareness.
So I did spend some time once Dave had brought it to my attention that he would like to explore that based on his understanding of what the Provider Alliance biggest wish was and functionality. So I started doing research. I came across this entity as well as a good 16 others through just research of various articles, postings, and looking at reviews as far as awards that have been provided by companies.
Okay, thank you.
Thanks, Linda. Any other questions or comments from board members? I would ask that we amend the original motion because I started with just a blanket approval motion to get the discussion started. So if the makers of the motion wouldn't mind amending it to the 39 months contract. I believe Megan and Selena were the motion makers. Correct me if I'm wrong.
I have no problems with moving it to the 39-month contract.
Yeah, same for me too, Phil.
Okay. Is there any further discussion on this item after changing it to the 39 months? All right, and this is to move it to full board. Hearing and seeing no further questions or comments.
Carrot, potatoes, green beans, corn. So everything's roughly the same.
All in favor signify by saying aye.
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 All opposed? Motion passes. Sorry, I was thrown off by the dinner order. Next is item 5B. Request for permission.
The phone just plays, the email plays the videos.
Request for permission to release a request for proposal for speech therapy services, occupational therapy service, and physical therapy services, private duty nursing, and nursing respite. Take a motion to approve.
Move to approve. Schmidt.
From Bush, support from Schmidt at the same time. Dave, if this is you, go ahead.
Thank you. I'm going to have Christina speak to this, but as a lead into our proposals have been posted in a number of different areas on our website, on the newspaper, things like that. There is a statewide website called the Mitten. It's MITN through BidNet. So I reached out. I thought there would be a cost to joining that. There is not. I followed up with purchasing at the county side. I think it was just a difference in terminology. I think they think of it as BidNet, and I asked them about Mitten. When I called the Mitten office, they were very nice, and Macomb does have an active account. So they will be adding Christina and myself to begin with. We can have an unlimited number of users. There's no cost associated with it. And we will be posting our RFPs on that site as well, hopefully in the very near future, probably anything for next month. So Christina, if you wouldn't mind talking more about this specific RFP?
Sure. Hi, everyone. So what this is for is we have a slight demand for OT and speech and physical therapy services. Openly, it's mostly due to COVID. The providers are just struggling. And so I did get a couple reports in the past week of instances in where persons were not able to get services at the desired contracted agency. And so just to ensure network adequacy and make sure that we don't fall behind and nobody misses out on services they need, I wanted to get this on the agenda right away and release RFPs for these service lines so that we have adequate coverage for those services. Similarly, with private duty nursing and nursing respite, we're not getting current reports of anything that is lacking. However, these service lines have very few staff. And so those providers have expressed that they're struggling a bit, again, somewhat due to COVID, but nurses are more in demand. And so especially when we look at the private duty nursing providers, they struggle to sustain those nurses and those staff more than, no more really than we would sustain nurses at a hospital or at the directs or at a clinic. So again, just being more progressive and wanting to ask to release these RFPs now so we can get a schedule together right after the holidays and start to release all of these. Is there any specific questions I could answer for you?
Thanks, Christina. Any questions or comments, board members? All right, pretty quiet. Thanks, Christina.
Thank you.
We have a motion and support. All in favor signify by saying aye.
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 All opposed? Passes. All right, next is item C, request to approve marketing item Entercom. Make a motion to approve.
Motion approve.
Support Vosberg.
Motion from Nagovan, support from Vosberg. Dave, did you want to start before turning it over to Cindy, or just let her run with it?
Yeah, I don't know if you want to bundle CD&E, but Cindy is prepared to speak to each of those. Entercom is, now I just messed it up. Out front is our billboards. WDIV, of course, is television. And Entercom, Cynthia, is?
Entercom is radio.
Oh, yes, is the radio. Hi, Cynthia.
Hey, how are you guys? So, ultimately, this is, these marketing items are reflective of what I propose in our, or in my strategic plan, marketing strategic plan for the year. And so, piggybacking off of that, these are the contracts to support that. Ultimately, the goal is to work around, people being at home during COVID versus on the road, and which is why the Out Front campaigns aren't starting until later next year in the springtime, because ultimately people are still working from home mostly, and it just wouldn't make sense to me to try to get billboards out at such a high level and spending that much money while people are at home. And while people are at home, they're watching the news every day, and they're listening to music while they work, like me, or they're listening to the radio in some type of format to, stay in the know about what's going on in their communities, or at a larger level, which is why we chose radio and television. So these are the contracts to support that. If you have any questions, definitely lay them on me. I'm right here. And I do want to make a note that the funds to support these are being paid for through grant funding.
Both the CCBHC grant, and we did receive some additional funding for the opioid health loan as well, rather substantial amount, which are contributing to these contracts.
Thank you, guys. Board members, any questions or comments?
No.
I do.
I have something. I like all of it.
Thank you.
Thanks, Tony. Was there somebody else also?
I have a couple
I
of
do
questions.
too, and I even tested out that telephone number, Cynthia, and it's a working person. It's a Macomb County person, and she was very friendly and helpful. So
Awesome.
And then I checked out that TV station. I had never heard of that. And so I got to watch some Barney Fife. And so that's a TV station I never heard of. Me TV, was that selected? It says all classics. So MASH was on. That was selected because of a certain audience.
Yeah, so it comes with a package of other, smaller stations that they work with as well, and that being a part of it. So, they reach a lot of different audiences ultimately, which is why we went with them.
Good, thanks.
No problem.
Thanks, Linda. Nick, go ahead.
Cindy, The questions I have, one is I was concerned about the cost, but you've indicated they're grant dollars, and I assume they're grant dollars that can't be used for direct service, that they're there for advertising dollars.
Yeah, we worked through earlier budgeting with for the CCBHC to work in grant funding for marketing services specifically.
Very good. The only one that gives me pause then is the billboards. One for the reasons you've just expressed, and I'm not sure that January. When did you intend to start putting the billboards up?
Billboards won't be going out until about April.
Okay.
Yeah.
And is that flexible depending on what happens with the pandemic?
Yes, it is.
Okay, good. The other concern I had about the billboards was with telephone numbers. I don't know. I don't know how you write down a telephone number or an email address while you're driving, at least safely. I guess I have some concerns about using billboards for that purpose, for outreach, not of the fact that we exist, but of trying to push people to particular phone calls or websites, because I think that creates a potential danger.
Absolutely, and I can completely resonate with that, especially while people are driving. I agree. I think it's important to make sure that the information is there in case maybe there's a passenger that can capture that information while someone is driving. But even outside of that, the main focus of the billboards isn't just to promote a number or to promote a website. It's to promote knowledge of our organization and to promote awareness of who we are, so that people are saying, who is CCMH? What is MCCMH? Let me remember that, because it gives me something to go maybe Google later. Especially as it relates to, the services that we provide centered around mental health, substance use, et cetera.
I almost think that putting the message into the billboard of Google us or something of that nature is better than putting the phone number and or the specific website, because I really don't want to do anything that encourages drivers to be unsafe.
I understand that, and it's definitely something we can explore as we develop the content for it, because that hasn't even been done yet. I can speak to what's been a little successful in the past, just based off of market research and things that we see on the roads, which is typically just promoting the name of the organization, a photo that gives them something to remember it by. Or even thinking of that woman, I think Jumana, I think everyone knows that billboard, right? It's because you've got a photo of this woman, you see the name, and that's all I needed in order to know that it has something to do with law. Her name's Jumana, and there's a picture of this lady on this billboard. I mean, it really is just about likeness and giving people something to remember later. So, whether it be a message or photo or whatever, I think we can definitely, get our point across.
Yeah, you can play with the content. I trust you to do that. But as long as you're aware of that concern, I just want to make sure. Thank you.
Thank you.
Thanks, Nick. Any other board members with comments or questions?
I have a question.
Ryan, go ahead.
Cynthia, thank you for emailing me back today. I did read your email. I have a follow-up. I asked Cynthia and Dave about the placement of the billboards. And I'm concerned that, I'm all in favor of the billboards. I share Nick's reservations with numbers and so forth. But I think just the placement, it looked like they were heavily concentrated in one area to the exclusion of Sterling Heights, Shelby, the entire west side of the county and the north side of the county. And is there a way to hit some of the billboards on M53 and Hall Road?
Absolutely, there are. It's not a problem for us to, like I mentioned with Nick, we can make adjustments to this, no problem. It's just, for me, I think I can't remember if I wrote this in the email or not, but, having it on the main roads, on these highways, that's totally fine. Hall Road specifically, I think is very important. And if that was missed, I'll make sure that we get that on there. But in other areas, personally, just based off of what I've been seeing, people aren't on the road as much. And even when things go back a little bit more back to normal, people are still going to be very much working from home. So thinking about, you know, what are the areas, you know, in terms of what they're driving to, you know, when I leave the house, I'm just going up the street to the grocery store. Any billboards that I see on the way to the grocery store are what I'm seeing on a daily basis. I'm not on the highways. And so understanding that, you know, for me personally, and also other people and just people, you know, within our industries that are, you know, have these white collar jobs or blue collar jobs for that matter, ultimately, I felt that it would make more sense to have them more neighborhood focused. But if we want to, you know, revisit it, move it around a little bit, that's not a problem. That's an easy fix, no problem.
Thank you. I just would like to see it countywide rather than concentrated.
Yeah.
Right.
Yeah, not a problem.
Phil, if I can comment too. We are looking at the countywide demographics, and it came up in one of our meetings in the past week. We also have our mobile health unit, which is moving along nicely. We expect it to be on the road in January, and we will be doing targeted outreach as well, countywide, especially northern Macomb, and you know, we'll hit everywhere as we go forward. But we are getting more precise with our outreach. The CCBHC grant has some very specific agencies and things that we need to be connecting with, and we're doing really well. But we are getting more sophisticated. We'll probably be looking at some geo mapping and things like that to make sure that our message is getting out countywide.
Thanks, Dave. Kathy, did you have a question?
I did. Some of it's kind of been addressed, and that is the marketing of it, determining the market and the demographics of the market, because there might be certain areas of the county that our services really can't be utilized. They could be for the initial phone call, but then for the ongoing services, there may not be enough people there who would qualify. So I was just going to ask, are you looking, does the service provide, the company we're going through provide that data and those demographics?
I definitely think that they can provide demographics in terms of the areas that we're in. Yeah.
Great, thank you. I like the entire concept, including the billboards, because as you said, it's not that you quick step your car to write it all down, but it's another visual of that there is something available. And then when you see it, when you're watching MeTV, then you go, oh, that's like the billboard I saw. So thank you.
Exactly.
Right.
Mm-hmm.
Thanks, Kathy. Any other board members with comments or questions? All right, hearing and seeing none. Motion and support was for item C. All in favor signify by saying aye.
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 All opposed? Motion passes. Next, since we've already discussed D and E, I'll take a motion to approve items D and E.
Don't move, Burke.
Support Schmidt.
Philip.
Motion from Burks, support from Schmidt. Any last second questions or comments for Cynthia or Dave? All right, seeing and hearing none. All in favor signify by saying aye.
Aye.
Aye. All opposed? Motion passes. Thank you, Cynthia.
Thanks, Cynthia. It was great.
Thank you.
Thank you, guys.
Next, we will move on to item 6, receive and file. Item A, QAPIP, Quality Assurance Performance Improvement Plan. Take a motion to receive and file.
Motion to receive and file.
Support. McGovern.
Motion from Ryan, support from Brian. Dave, did you want to speak to this?
Yeah, actually, I was going to read our QAPIP. It's on pages 89 to 220 in your packet. So get comfortable.
I already read it.
Dave, I gotta go. Ryan can take over for me.
It is a requirement for that this be presented to the board, to our CAC. It's an annual document, A lot of work goes into it. So a big thank you to Cindy Conal and her team and the various other departments who contributed to it. I believe, Cindy, correct me if I'm wrong, we will be asking for approval at the full board, but we recognized you needed to have some time to make your way through this document. Other than that, it is an important document. It is reported to the state of Michigan as our quality indicators and the performance improvement projects that we're working on for the next year. And Cindy, did you want to add anything to?
That's pretty comprehensive. It will have the Integrated Health Macomb, which is the CCBHC annual work plan, as well as the PIHP annual work plan. Another thing that will be added to it is the annual report. So there is a summary under the final 2019-2020 annual work plan. That's at the very end of the document. But we met with our HSAG, it's Health Services Advisory Group, yesterday, and the state. And they would like an annual report also. So I will add that to it, and we'll ask for approval probably at the full board. If not at the full board, it'll be in January.
Thank you. Any board members with questions or comments? Brian, go ahead.
How many pages are they going to add to the report?
Well, I'm not sure, but there's a lot that you can ignore. So from pages, let's see, the attachments are just code books, and the attachment is page 99 to 139. Page 139 to 180 is another code book. So try to ignore the attachments. Those are just the things that we have to follow when we do our reporting to the state. And
Thank you for doing that.
Attachment. The work plans are important, as well as the quality assessment and performance improvement program. And like I said, we'll come up with the annual report. The summary will pretty well explain what we've done through the last year, but we will also put it together in a comprehensive report for you.
Thank you.
You're welcome.
If the board would like, it would be worthy of a study session, but that's at your discretion. We're happy to give updates as we go through, and we are forming the new board work group subcommittee related to finances and programs and services. And some of that will tap into some of these areas on our QAPIP.
Thank you. Any other questions or comments? All right, hearing and seeing none. We have a motion and support to receive and file. All in favor signify by saying aye.
Aye.
Aye. All opposed? The report, well, the plan is received and filed. Thank you.
Thank you.
Next is item 7, resolutions. Madeleine Abbey retirement.
Oh.
To approve the retirement.
Madeleine has
to retire.
Madeleine has requested to not have a formal resolution, so we will just wish her all of our best. She will be retiring next month and has given official notice.
Thanks, Dave. Well, if there's no official document, do you ever really retire?
We found that out after the agenda had gone out. So yeah, there's no need for a resolution, but
we don't have to, she's going to be retired. We don't have to listen to her. We can skip a resolution if we want to.
We can send it in the mail.
Discretion, but that was her preference.
If somebody would like to make a motion, I'd be more than happy to entertain it. If not, that's okay too.
I move that we acknowledge the retirement of Madeleine Habib. And may the minutes reflect we're grateful for the service she has provided.
Motion.
Support.
Second Phillips.
All right. Any other comments from board members? All right. Seeing and hearing none, we have a motion and support. All in favor signify by saying aye.
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 All opposed? She can retire officially. Next up, item 8, other possible agenda items. We will go to 8A, the CEO update from Mr. Pankatai.
I can't retire yet. On the finance side, Richard's, there's some family medical concerns right now that he's managing. There is a proposal we would like to bring forward to the board. We were going to present some detail today, but we will, with your permission, hope to have that ready for next week's full board meeting. It does pertain to the $2 an hour direct care wage premium pay, which is set to expire on January 1st. So we will try to get you details as soon as possible for your review and comment, and then have it on the agenda for the full board. We had kind of a lively discussion about the statewide crisis lines. There is a meeting coming up about the Stay Well line. And we did the state released official notice that the MyCal line would be going active in April. MyCal is the Michigan Crisis Access Line. It's the state's intent to make that phone number available to every person in the state of Michigan. The global resource and information. They would be looking at our community mental health component as part of that, including the psychiatric bed registries, and they're clumping a lot into those projects. It's my understanding the Stay Well line, which was started with the CARES Act funding, will be merged, incorporated into the MyCal line down the road as well. So the state's moving forward in that direction. On the internal good news report, I was happy to share the email earlier today about Thomas Cole. I need to pull it up. Because I cannot remember the exact name of the award, and I don't want to misspeak, so I am pulling that up.
Dave, for the MyCal, Common Ground is going to be the primary source for it, and Oakland County is the pilot for it.
It's the Nick Fillinau Award, Dave.
Thank you. So I shared, yeah. Bill Adragna is our Chief Information Officer, and when this award announcement became public, he and I spoke about nominating Thomas. Apparently, this award historically has gone to a Chief Information Officer at one of the CMHSPs or PIHPs. But Thomas, you guys have heard him speak and present on the IT tech issues coming in front of the board. Has just, been doing a phenomenal job helping us with the tech upgrades and having everybody work remotely in navigating the cyber attack we had last year. So he did receive the official award notice, and he will be getting that at the statewide conference. I gave you the date too, but I don't have that in front of me. But we're all very proud of Thomas, and it's very well deserved. And it's always, like I said, it's nice when I'm scrolling through my emails to get some good news out there. I also wanted to mention, a big thank you to our nurses. We were contacted by the health department in preparation for vaccine distribution. No details on that yet, but they're prepping and planning. So Tracy Smith, our chief of staff, did meet with our nurses, got very good response, and that was shared with the health department about their availability. So a big thanks to our health department, to the entire county, the emergency preparations that are, the planning that's going on right now. So when we do have those vaccines available, they'll be able to administer them. Tracy, you're on, I think.
Yes, sir.
Can I ask you to give us an update on the holiday events?
Sure. So all of you, we've been sending you the emails. So in case you haven't seen them, we have a holiday extravaganza week. Obviously, we're working remotely, so it's difficult to do our traditional holiday party. So you'll see beginning on Monday, the 14th at noon is our first event. It's virtual. And each day we have an event. For example, one day is ugly sweater / holiday costume contest. Another day is a cookbook contest, which you can submit recipes now. And they're gonna have like a live demonstration of one of the best recipes, again, at noon every day. And then another one is a holiday scavenger hunt that you can include your family on. And again, it's at noon during the lunch hour if someone so chooses. What's very cool about the events is they are live in the way that some participate, but we also design them in case someone can't make the event, that they can put submissions or try to do some of this stuff and still be entered to be a participant. There's a ton of cool prizes. Our leadership is extremely generous, and I'm proud to say that we have a ton of $25, $50 gift cards for various places like Panera, Starbucks, and Amazon. And then we also have some lovely gift baskets. So everybody who participates, if they're the winner, they're definitely going to get a prize. If they're not, there's a high chance that they're going to participate. The event that we're most excited about is we have a live drive-in happening for our staff on Thursday, the 17th at 6:30 at our west location in Sterling Heights. You all are invited, of course. You can participate by physically showing up for the event and be in your car with whomever you choose, or you can live stream with us, and we're going to be watching the movie Elf. So this week, I apologize, but you're going to be reminded daily about all the cool upcoming events. And if you're interested in any of them, it gives you the links of how to participate or how to learn more about them.
Wow.
What's really impressive is Tracy didn't know I was.
Nice job, Tracy.
So that was all off the cuff. Thank you very much, Tracy.
Absolutely.
All right. And I wanted just to mention too, we met just before this meeting. We are working on an annual report. I'm not sure what was going on before I started, but we had our first kickoff meeting today. We're fast tracking it, and hopefully we'll have some draft information to you guys early in the new year, and we'll be able to publish that by the end of January is the time frame we're looking at. So fingers crossed, and lots of work between now and then, but we were off to a really good start just this afternoon. And I'm sure there's lots more going on. I'll have more information for the board meeting next week. So we're on this accelerated schedule because of the holidays for December. So thank you.
Thanks, Dave. Any questions or comments from board members for Dave? Or any other possible items you want to talk about? All right, it's pretty quiet. So I just have a couple of reminders for everybody. Please get your November expense reports into Sandy as soon as possible. And then, as David mentioned, our full board meeting is next week, 1 week from tonight. It's not in 2 weeks. And I also want to give a personal shout out and congratulations to Thomas, because I'll never forget how he came to one of our meetings in the true sense of the word virtual. I believe he was camping with his family and still took the time to be out in the woods and zoom into our meeting to answer our questions about one of the agenda items. So definitely well deserved for Thomas. So Dave, thank you for the report. With that, we will close other possible agenda items and we will move on to hearing of the public. Again, you have 5 minutes. Give us your name and address. And I have Alicia Oaks on my list. Alicia, are you still there?
Yes, I am.
All right, go ahead, Alicia.
Hi, yes, my name's Alicia Oaks. My address is 16 Market Street, Mount Clemens, Michigan, 48043. I'm giving my business address just because of what I do for a living, and I don't want the public having my home address. I joined tonight because there's a lot of issues. As some of you may know, Bob Schumann, who quite frankly is probably one of the best therapists my family has worked with, submitted his letter of resignation, giving his clients less than a week to figure something else out. At the same time, Macomb County is trying to eliminate wraparound services for my child who needs them. His CAFAS is the highest that it's ever been. There's a whole lot going on. Some of that is created by community mental health, like now a lack of a therapist. The fact that we had a psychiatrist, now we have a new psychiatrist who decided she doesn't specifically like certain medications that Jordan was on, so that had to be changed, which now is causing violent outbursts in my home, all while they're trying to take away services. That's a big issue to me, a huge issue to me. And I understand it's the pandemic. That means he's not getting face-to-face services with therapy. There's a whole lot going on, and I get some of it nobody is going to ever have an answer to. But what I want to know is why are services being taken away from kids who desperately need them? Why? And I'm not getting that answer. And here's what I can tell you. His team doesn't feel like Jordan should be kicked out of the wraparound program. So it's coming up from higher up than that. And I will get down to the bottom of who's trying to pull the plug. I will appeal. If I lose the internal appeal, I'll appeal to the state. I'll do whatever I have to do to advocate for services for him. But what I can tell you is this is wrong. And even though they knew he was losing his services, they're still attempting to pull the plug. And that, folks, is where the problem comes. So how many kids out there during this pandemic are getting resources ripped away from them because their parents don't know how to advocate? Their parents don't know to come to this board and to tell you what's going on. Their parents don't know how to appeal. I'm lucky enough to be educated enough to be able to advocate effectively for Jordan. Not everybody has that ability, and I realize that. And what's heartbreaking about the situation is I don't know how ethically anybody could make the decision that they're making. And being a licensed professional myself, I don't say that lightly. I truly don't say that lightly, because I wouldn't want somebody coming up after my license for something that's a borderline question. But what I can tell you is that I'm extremely upset. I think that the board needs to know that this is what's happening to our kids right now. And quite frankly, something needs to be done about the turnover rate. My daughter went 4 months without a therapist. She's had 4 therapists in the last year. That's an issue. There's no reason why we're losing people the way that we are, and good people. We had an excellent wraparound coordinator, Sherelle Zemas. If I could have her back, I'd take her back in a minute. Now she's Brooklyn's therapist because she moved roles. This is our 3rd wraparound coordinator. There's huge turnover issues, and I think that that affects the level of care that a child is receiving. And I just think that you need to be aware of it, because these are issues that we're dealing with as parents struggling in this pandemic world where you've got online schooling and a bunch of changes that are affecting these kids. And now we don't even have a therapist to help him navigate through. He's been inpatient hospitalized 14 times. So when I tell you he has severe issues, he has severe issues. This isn't just somebody saying it, and I think my peer support specialist said it best. There are parents who are afraid of losing services, and there are parents that know that those services are essential to helping their child through life right now. And I'm one of those parents. Thank you for taking the time to listen to me, and I sincerely hope that Dave takes the time to look into this issue and see why they're trying to pull the plug on a kid who desperately needs services.
Thank you, Alicia. Thanks for sharing that with us. Any other members of the public wishing to speak? Hearing of the public going twice. Third and final call for hearing of the public. All right, with that, we will close hearing of the public, and I will take a motion to adjourn.
So moved, Schmidt.
Motion from Selena, support from O'Connell. All in favor, signify by saying aye.
Aye.
Aye. All opposed?
Aye.
We are adjourned.
Thanks.
Until next